Now I'm going to, I have the pleasure, I really do have the pleasure to introduce a remarkable individual that I met in Boston earlier this year. After hearing Sammy speak, I knew our community needed to connect with him. He embodies hope, strength, and determination. And he also has a really good sense of humor. In addition to being an author, scientist, and advocate, he is an amazing human. I am so honored to present Mr. Sammy Basso. And thank you so much. I know you've been traveling in China for conferences, so we want to thank you so much for taking the time to talk to our community. So I'll pass it on to you. Thank you, Sammy.
Thank you. Thank you very much. It's a pleasure to be here with you all. And thank you for the beautiful presentation. I really wanted to be here. Despite I'm still with the jet lag, I was very willing to participate to this beautiful meeting. So as you said, I met you and the Cure Mito Foundation a few months ago at the Broad Institute in Boston, where I was invited to give a talk together with Prof. David Liu, who's the inventor of base editing and prime editing and other innovative techniques to engineer DNA. It was a meeting on rare diseases too, where we talk about life experiences, difficulties, pain even, but above all, a lot of hope towards the future, towards science, towards research, a research that is often the result of the united effort of families, researchers, and doctors. And what to say, it's precisely a story of hope that I would like to tell you today, which starts from when I was a child, but touches families all over the world. I am affected by an ultra-rare disease called progeria, which has one affected person in every 12 million, more or less, a total of 400 cases worldwide, of which we know of only 114. When I was born, progeria was not visible at all. I looked like any other child, healthy, without any problems. But from the first month, small symptoms began to appear, which did not seem related, but overall could not be explained except by a bigger picture. And so, after many inconclusive visits and tests, I was subjected to a genetic examination. It was 1998, and the human genome had not yet been sequenced. So it was a very rudimentary visit, but enough to understand that I had Hutchinson-Gilford progeria syndrome. And so the doctors looked at my parents and simply said, your son has progeria. It is a very rare disease, also known as premature aging. His life expectancy is only 13.5 years. There's no treatment, there's no research. We are very sorry. So, in short, they were telling there was no hope. More than a diagnosis, it was a sentence. Perhaps this is a story that many of you may have experienced. This is often the case with rare diseases. And my parents didn't really know what to do. They were devastated. But they had many insights that were definitely correct, I would say. They decided, in spite of fear, to raise me like any child. Fought for me to have all the experiences that others do too, sacrificed a lot for me, and raised me with strong rules and values, not giving in to the easy belief that I could be an exception to the rule. They decided to raise me so that I became a complete person and I could make a difference in the people and the world around me. So I'm very, very grateful. to them. At the same time, they never gave up on the fact that there was no hope and continued to seek, ask for help, and try to network with whatever people were willing to help. In 2000, for the first time, they found an association that brought together kids with progeria and their families. So we flew to the United States for the first time. And by the way, I'm really loving States, of course. It was like a ray of light illuminated the darkness we were in. For the first time, we met people in the same situation as us. And for the first time, I felt that I was not alone. That there were people to whom I didn't have to explain anything. For the first time, we met a family that would change our lives forever. I'm talking about the family of Sam Burns. He is very famous for a great TEDx talk he did some years ago. And he also had progeria. He was like 1 year younger than I was. And they too had recently found out that Sam had progeria. And they had founded an association, the Progeria Research Foundation, to understand the causes of this disease and to do research and ultimately to find a real cure. It was like a dream that time. In a few years, a real scientific miracle was accomplished. In 2003, the gene that causes progeria was discovered, and as early as 27, a clinical trial was started to treat patients with progeria with an experimental drug called lonafarnib. I was among the first group of patients to undergo this therapy, and it was not easy at all. The side effects of this drug were very heavy. I was sick all day and all night. I was vomiting a lot, and I was not sleeping at night, so it was quite a nightmare at that time. But the team of doctors at the Progeria Research Foundation were always there for me and accompanied me on this journey so that I could keep the side effects at bay and could continue this therapy. And besides, I had no intention of quitting. It was my only chance to have a better life. And so it was. After 13 years, lonafarnib was approved by the FDA, making progeria one of the very few ultra-rare diseases to have an approved treatment. Now, 16 years later, I'm 29 years old. I've doubled the years that the life expectancy given by the doctors projected to me. So the drugs works, and it is working in many other patients, and I'm very, very happy for that. For all these reasons, I decided to become a scientist, a molecular biologist, and after so many people had worked to ensure a better life for me, I felt it was my turn to put myself out there and study my own disease to ensure the next generation of kids with progeria better treatments and possibilities and a real cure in future. And perhaps we are closer to that, to the real cure, than we ever imagined a few years ago. I was talking about the Broad Institute meeting in which I met Casey and the Cure Mito Foundation, and I was talking about David Liu. He and his team have invented an innovative system called base editing, which is of incredible sophistication. In a nutshell, they have created in lab an enzyme that can rewrite letters of our DNA. And they are able to shuttle this enzyme anywhere in the genome so that the chemical reaction performs exactly in the letter of interest. And this is really amazing and mind-blowing to think, because most genetic diseases are due to a mutation of a single letter out of 3.2 billions of letters. And that means that ideally, when we are able to get to every single cell in our body, we can literally heal from genetic diseases. What was only a distant dream could in a few years be a tangible reality. And the funny part is that David Liu decided that progeria was a great model to study this new technology. So now, a team of very valuable scientists, led by the Progeria Research Foundation, is currently testing a method to bring this technology to patients. And if everything goes right, in the next 2 to 5 years, more or less, hopefully, we will have taken the first step to a definitive cure for progeria. And if I can say it, I am proud to be part of this group of scientists that will hopefully be able to give a cure not only to progeria, but also to many other genetic diseases. Can you imagine one day in the future, we will be able to say to a family whose child has been diagnosed with progeria, your child has progeria. It is one of the rarest diseases in the world. It is also known as premature aging, but we know how to cure it. It's quite different from the sentence that was given to my parents during my diagnosis. So, why am I telling you all these things? Just for sincerely tell you that I am very close to you all. I know that even for QR Mito Foundation, and probably for many others here, the work of family who have known how to involve doctors and researchers has been and still is crucial, pivotal. But perhaps you don't realize that you are also doing so much more. You are showing all patients who will benefit from your work that life, even with a genetic disease, is worth living. I have learned it too after years of battles and victories and defeats. Life is worth living, always. Being um, a genetic disease does not stop us from being real, genuine people. A genetic disease does not stop us from growing in this world, from being helpful to others, for reflecting the immense mystery, I should say, of life itself. On the contrary, a disease often helps to understand many things. I, without progeria, would not have understood that my path was science, for example. Without progeria, I would take so many things for granted. I would take for granted the ability to run or to jump or to walk for a long time. Now I cannot do that because progeria does not allow me to do that. And so I'm happy when I see my friends who can do all these things instead. Without progeria, I would not have met some of the most important people in my life, much bigger than what a disease can take away. Without progeria, I wouldn't have been able to travel the world as in China just 3 days ago, and to bring my experience as a patient and scientist. Without progeria, I wouldn't have met a lot of different cultures, and I wouldn't have made encounters very critical to my growth. Encounters like Nobel Prize winners, stakeholders, president of different countries, even Pope Francis. And but most of all, without progeria, I wouldn't have realized that the world can really be a beautiful place to live. Sometimes we look around and it seems like everything is just, I don't know, war, overwhelmed, bad news. Thanks to progeria, I have seen so many people knocking our door to simply ask, what can we do to help you? That is why I know that the work can be evil sometimes, but that there is also so much good out there. Silent, maybe, but precious like nothing else in the world. If I understood all this, it was because of my illness, but I would never have been able to do it without my parents in the first place, and all the people who poured their strength and sweat into allowing me to live the life I'm living. You are also doing this to your children and your patients, giving them a chance to hope for a better future and to give deep meaning to their lives. And for that, I will really, really thank you all. Thank you.
Thank you, Sammy, so much from the bottom of my heart. I truly admire you and all the work that you're doing for not only progeria but for all rare diseases. So thank you so much. I hope you can get some rest. And
Well, I'm not a person.
well, that's good. That's good. Well,
Yeah, absolutely.
thank you again. We love you, and we hope that the base editing becomes available in the near future. I mean, for sure. So what you're doing is groundbreaking, and it's truly changing the history of rare diseases. So thank you for all that you do, Sammy.
Thank you. Thank you so much. I really hope base editing will be a thing very soon. As you said, I have a kind of self irony, but in this case, it is true. I'm a very stupid guy, and I want to continue to do stupid things, but I can do it only with base editing. And my disease mates are the same. So really, it would be a dream becoming true to have this therapy, not just for progeria, but for all the diseases. I
Yeah,
really believe this will be a part of our future.
absolutely.